The CDC identifies a simple way for kidney patients to lower their risk of developing a deadly blood infection during dialysis treatment. Here to explain is Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at Mass General. Dr. Raja, thanks for being here.
Thanks, Eric.
All right, Dr. Raja, more than 500,000, half a million Americans rely on dialysis to replace the function of their failing kidneys. How does it work?
So, Ben, basically, dialysis basically does the work of normal, healthy kidneys in patients who have what's called end-stage renal disease. The most common type is called hemodialysis, where blood is actually removed from the body, and the waste products, the salt, the excess water are taken out. But the process is pretty safe, but occasionally it can have complications, like infections.
Yeah, so researchers say these infections, they can be serious, even deadly, some even resistant to antibiotics. So how are they getting into the bloodstream?
Well, Erica, there's a bunch of different types of hemodialysis lines that can be hooked up to the machines. Some of them, called central venous catheters, are basically large IVs that are put into the neck or the chest. More permanent lines are called grafts or fistulas that are actually made between arteries and veins. These grafts and fistulas are long-term and they aren't as prone to infections, but those large IVs are actually 6 times more likely to get infected.
All right, as you know, there are different ways to connect a patient to a dialysis machine. So based on this study, what's your advice?
Well, Ben, I'd say that the best advice to try to transition from a longer-term graft or fistula as soon as possible, or to a longer-term graft or fistula as soon as possible. I know that nephrologists and their patients are focusing on that, but if you do have one of those short-term lines, the important thing is if you start feeling a fever or weak or have a fast heart rate, call your nephrologist as soon as possible. It might be an infection.
All right, Dr. Raja, thank you for that.